Okay, hi everybody. So, if you're interested in covering your face in public, I'm just going to read from the CDC website really quick. In order to help slow the spread, it says to clean your hands often. So, wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. And avoid touching your nose, and mouth with unwashed hands. So, uh, that's going to be your number one defense. Avoid close contact, social distancing, staying home as much as possible. That's going to be your second best defense. So, they've added cover your mouth and nose with a cloth face cover when around others. You could spread COVID 19 to others even if you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public, for example, to the grocery store to pick up other necessities. Cloth face covering should not be placed on young children under 2, anyone who has trouble breathing or is unconscious. And as Greg said, why would you go to the store if you're unconscious? So the cloth face cover is meant to protect other people in case you are infected. And do not use a mask meant for a healthcare worker, and continue to keep about 6 feet between yourself and others. So the cloth face cover is not a substitute for social distancing. And I think that's kind of one of the points I want to make is that the mask could give you a false sense of security, kind of like a pair of gloves in public. You think, oh, I'm protected. I don't have to be careful about the way I spread germs. So that kind of brings me to our masking. So if you really want to cover your face in public, I want you to keep a couple things in mind. So we have our PEEP. If you're covering your face, make sure that your nose is covered. There's a little nose. Make sure that that's covered. And that once you place the covering on, you're not touching it. You're done. You place it once. You make sure it's properly fitted the one time with clean hands. You go out into public. You do not touch this again until you are ready to take it off. And you do not touch it again until you have clean hands. So I think that's what's kind of driving me crazy is I saw a lot of this. Saw a lot of people just wearing it down, and that's his chin. I saw a lot of people wearing it down underneath their chin, or this, like partially covering their nose, because it's very uncomfortable wearing them for an extended period of time. You feel like you can't breathe, and you have to have mouth breathe. So I kind of made a little makeshift mask here from a cloth and some rubber bands, and this is our model here. So if you really want to cover your face, and let's say pretend you have a surgical mask, you have your two loops. You have your two loops. So you're going to take one loop and you're going to cover it over the one ear. Then you're going to take the other loop and go to the other ear. Then, and your hands are clean, right? So you're going to take the time right now to make sure you have a nice seal over the bridge of your nose. You're going to take the time to make sure that that surgical, that elastic, that like thick part above is forming a seal across your face. And then you're going to take the time to pull it down underneath your chin and do the same thing and give it a nice, good seal. So, and then like I said, once you have it positioned and you're ready to go out in public, you're done. You don't touch it again. So, if I were covering my face when I went out into public, and let's pretend I had a real mask, a surgical mask, I would wash my hands, put it on before I left my home, and I would not remove it again until I was home. Assume this is covered in germs. And if you operate under that assumption, you will have a much higher consciousness about touching anything, especially this area. So just because you're covering your face, it's not a free pass to go ahead and touch everything. It's the intention is a reminder. The intention is to spread droplets from going out if you're talking or coughing or sneezing. So that's the intention. Um, the other recommendation is to disinfect frequently touched surfaces. So a couple times a day, I go around my house, I disinfect all the door handles, all the light switches. Um, the keys, we are in a point where we just hang them by the door. I disinfect them every day, but I don't go crazy with those. I just hang them by the door, and I try not to really play with them too much. And then as much as possible, if you have a contactless card or if you could do Apple Pay or Android Pay at the store, so that way you're not touching the keypad and you're not handing over cash. I've gotten strange looks even for transactions of $1. I just do the contactless because then I don't have to break my money out. So then when you are home and you're ready to take your mask off, once again, assume this is completely covered in germs. So you're going to very carefully take one loop and go downward. And then with the other hand, you're going to very carefully take the other loop and go downward. And you're not going to touch the mask at all. It's going to go in the trash. They are not meant to be reused. You can use it for an extended period of time, like if you're going out, if you have work and you leave it, you put it on when you leave in the morning and then you don't take it off till you eat or drink. They're really not intended to be reused. So that's kind of another caveat to not using the surgical masks right now, as they are in short supply. I have to be perfectly frank. If someone gave me surgical masks, I would turn around and give them to the hospital. I wouldn't use them. They need them. We don't. So then once you have your mask and you're dumping it in the trash, you're washing your hands. Okay. So that's the biggest take-home point is once you have the mask on, you're not touching it. You are washing your hands prior to removing the mask, okay? It goes above your nose, it goes underneath your chin, and you don't touch it, you don't reposition it. They're very uncomfortable, they're hard to breathe in, so really only if you are and want to be using those, then just remember that. Make your outings really nice and short and brief, and stay healthy and safe.